a great smile, we're going to help you achieve one, especially in the new year. So tips of what we can possibly do, Jackie.
Yeah, that's right. We're heading into the new year, so we want people to think wellness, and a big part of that is, of course, your mouth.
Right.
Good morning, Dr. Stephanie.
It's a lot easier than going to the gym.
That's true.
That's a very valid
That's
point.
true.
Dr. Stephanie Moen here from Plaza.
We do all the work for you. It's really great.
And you've got that hot wax thing. You put your hands in it. Oh, it's wonderful.
See, I've never experienced that yet. Is that something that's pretty normal at your place?
It's very normal at our place. You come in, we dip your hands in wax so that you're kind of warm and comfortable, especially this time of year, and then makes your hands really soft. Just kind of something, I think we try to give people an experience that they don't expect, and so just something a little different, and that's something that people really like.
And the start of a new year would be the start of maybe getting your dental hygiene a little bit more on track?
Yeah, well, there's things that you see. I mean, we see people smile, and there's also things, I mean, like anything in our body, things that we don't see, that we don't, that live underneath, that we can't really look at every day. And so a lot of people have gum disease and don't really know it. Statistically, there's about 80% of the population that has something. So if you have something that bleeds when you brush your teeth or when you floss and something bleeds, technically that is a sign of gum disease, and it's
Now, I just had a friend go to Plaza Dental, and it's amazing. You always hear about flossing and gum disease and things like that, but he had a special cleaning for his gums. One, he opened his mouth and the doctor instantly was like, "You haven't been here in about 5 years." And he's like, "How did you know that? Just looking at my mouth." You guys
your
can
grill
tell.
don't look so good.
Your grill don't look so good, but you guys can tell.
Yep.
But he had a special gum cleaning. Can you explain what a gum cleaning is?
So if you've skipped 5 years of cleanings, the most important thing is to sort of do some catch up. And what that really means is that we go in for a longer period of time, and we spend more time cleaning down underneath the gums and around
How
the
far
teeth
do you
a little
go
bit more.
in?
Well, so when you go to the dentist, you should see the hygienist, and they should do readings, measurements around your gums.
Is that where they stick that little thing up into your gums?
One,
and they
two,
go
three.
1, 2, 3.
Yep. And anything. And it's funny because my dad used to say, "Oh, those 1s, 2s, and 3s, those are fine, but those 4s and 5s, those really hurt." And I said, "That's the whole point." So if you have something that
Now, what do those numbers mean?
3 and below is usually normal, unless
Which means your
there's
gum
bleeding.
is pushing back only that little bit?
Exactly. So if the gum should be nice and pink and tight and healthy around the tooth. And if your gum gets a little flappy or inflamed or bleeds a little bit or whatever, then you'll get some of that gum tissue pulls away from the bone a little bit. And so you'll get more area in between there that the probe can go down.
So the little poker goes further up into your gum.
It goes further up underneath there. So it's harder to clean underneath there for you, and then we have to go down with special instruments and clean around it. It sounds terrible. It's really quite comfortable for people. It used to be a little more uncomfortable for people. Now we've kind of figured out how to make it a little more, friendly.
How do they clean? Do they have to scrape it, or do they use water?
Yeah, we use ultrasonics mostly to clean because it's more comfortable for the patient, and it really kind of flushes out everything. And we're really working to get the bacteria and the kind of that tartar or that plaque deposit out from underneath there. So it's interesting. This is way nerdier than you need to hear, but there's also something called biofilm, and biofilm is sort of that sticky stuff that sticks to the teeth, but you really can't see it.
The socks on your teeth in the morning.
Yeah, exactly. Yeah, exactly. So that biofilm needs to be removed too. And what the studies show is that it actually takes several minutes per tooth to remove that. So if you multiply it by, most people have 28 teeth, so it takes a while to really get some of that off. So especially if it's been 5 years or so.
Well, it was a multi-hour process.
Yeah, really?
It takes quite a while.
I'm like, to clean your gums, but if it's been that long,
it needs a really intensive
process. This person does not floss,
right?
So there was some issues there, but you guys were able to take care of it.
Now, somebody that was to that extreme, what's their recovery time and what the future for their health?
Yeah, the recovery is pretty good. If you can get all of that cleaned out and then you have a good recovery, the body will heal. If you take the irritants out or the things that are causing the inflammation out, like that plaque and that tartar, then you can take that out, and then everything heals up really nice and pink and tight again. So most people heal really well. Some people will still have a little bit more space in between there, but for for the most part, people heal up and it'll get better.
Do you think people are a little bit more conscious of their dental health after they have a procedure like this done?
I hope so. I mean, we do. I mean, I don't know. We've talked about this, I think, in the past, but doctor, the root word of doctor is docere, and it means to teach. And so we educate people a lot. That's really what our job is. When you go to the doctor, they listen to your problem and then they educate you about what you should be doing. And that's what we do at the dentist as well.
That's interesting, because my wife is a doctor and she's always telling me what to do.
But
now you know the root.
Than most.
Turn my phone over.
So,
all right, so this might be an option for some people that might have been neglecting their dental health.
And you know what? And teaching and preaching are two different things, right? I mean, I think a lot of people in the past, people have said, you need to do this, and and there's no point to that. Nobody wants to do something out of shame. They want to do it because they're motivated, because they understand and they get it and they realize why they need to do something. So no, 2016 can be the year where you really get all those problems behind you. Fear holds a lot of people back from the dentist. We know that it does.
Yep.
And so we try and kind of make people more comfortable and have that. Lots of so many dentists are so good at it. Yeah, we should.
Yeah. Well, as you said before, you guys go to great extremes to make sure the patient is comfortable. You're not like, hey, come in, we're getting the drill and the pick. You do many, even little things.
Right.
Like
there are barriers to people walking through the door, let alone actually getting some of the treatment done. So I mean, we know what's healthy for us by and large. I mean, that's not super hard to understand. What we need to give people is a reason why it's really important. And I see a lot of people that have lost their teeth, and it's very, very difficult for them. It's disabling. It's their social life goes away, and it's very hard for them. So we're really tuned into that. We understand that people really need help.
Okay, here's another question that I'm asking, because there's a lot of people that are watching that might already have regular dentists that they've been seeing for years.
Yeah.
But they're watching you and they learn about some of the things that you're doing. They go, I'd love to go over to Plaza Dental and give you a try, but I don't want to get my dentist mad.
No. We don't want that either.
Okay, but the dentist won't get totally upset if they want to give you guys a try, will they?
No, absolutely no. And you know what?
Because you guys all get along, don't you?
I think so.
Yeah.
I mean, I do.
Yeah.
I hope so.
Because I think that might be a reservation for some people, saying, I don't want to bail on my old dentist.
Absolutely. And we do free consultations, so there's really no reason why you can't just come and sit and chat for a little bit and talk about it. Most dentists have a kind of a niche or a way that they like to do things, and if it isn't fitting, what's what you're needing, or you want to talk about something else. I mean, I had a patient the other day, they said, my regular dentist office doesn't do whitening. And I said, oh yeah, there's lots of people that don't do whitening. That's fine. I mean, that's okay. You can do that. So I mean, do we go one place and buy our clothing? Some people might. Guys probably do. Yes, I know. I know. But we do that. We choose different things. A lot of people have different. But that's they don't have one brand of car in the garage. Sometimes they'll go to different places.
That wouldn't be an issue. So that's not an issue.
I hope not. I would like to think not.
I think more importantly, find a good fit. It shouldn't be scary to go to your dentist.
And, you're right. A collaboration is not an unheard of thing. So yeah.
You guys do great things, whether it be softening the hands or nice warm thing around your neck.
I'm going to try the whitening thing.
They do great things.
You should. Yeah, absolutely.
Because you suggested that to me for a while, and I'm going to give it a shot.
You asked me. I didn't think I just randomly suggested.
Hey, you need some whitening. He needs some whitening.
As people are heading into the new year, yes, they might not stick with the resolutions very long, but what are the basic things people need to do to make sure they have a great smile in 2016?
I mean, definitely have a good relationship with your dentist. See your dentist, brush and floss. Just do the simple things that we ask you to do. Whitening actually is really healthy for your teeth. It's peroxide based usually, and that's good for the gum tissue and all. So it's not a scary thing. It doesn't hurt the enamel or anything like people think. And so yeah, just basics. Do the basics and just do them consistently. Every single day. I mean, I have kids that okay, did you brush your teeth today? Oh, I forgot. So just don't forget.
You should be on a good start then for 2016. Well, Happy New Year.
Happy New Year
to you.
Thank
I can't believe
Stephanie.
it's here.
I can't either.
Yeah.